This case study explores the clinical presentation and diagnostic journey of a patient with tetanus. We'll delve into the subtle clues, diagnostic challenges, and the importance of a high index of suspicion. Meet Alex, an 18-year-old male presenting with a history of recent minor trauma, a scrape sustained while skateboarding. Initially, his symptoms were non-specific: mild muscle stiffness, difficulty swallowing, and some anxiety. On examination, the physician noted subtle but concerning signs: mild muscle rigidity in the masseter muscles, also known as trismus or lockjaw, difficulty opening his mouth, referred to as rhizus sardonicus, and increased muscle tone in other muscle groups. A thorough neurological examination revealed hyperreflexia, generalized muscle spasms, and a history of recent minor trauma. These findings raised the suspicion of tetanus. Laboratory investigations were ordered, including a complete blood count, blood cultures to rule out sepsis, and tetanus serology to assess the patient's immunity status. The differential diagnosis included other conditions that can present with similar symptoms, such as meningitis, encephalitis, and strychnine poisoning. Based on the clinical presentation, neurological examination, and the absence of other plausible explanations, a diagnosis of tetanus was made. Treatment included supportive care, muscle relaxants to manage spasms, and antibiotics to address the underlying infection. The patient was closely monitored for complications, including respiratory failure and autonomic dysfunction. With intensive care, the patient gradually improved. Muscle spasms subsided and he regained control over his body. The recovery process was lengthy and required close medical supervision. This case highlights the importance of a high index of suspicion for tetanus, even in the face of seemingly minor trauma. Early recognition and prompt treatment are crucial for optimal patient outcomes. End screen with information on tetanus prevention, vaccination guidelines, and post-exposure prophylaxis.